My name is Jane Whelan. I'm one of the 500,000 people in Ireland living with migraine. It's estimated that up to 50,000 of us in that group live with chronic migraine. So that means we have symptoms over 15 days a month. And while many of us manage our migraine very well with the support of our GPs, most of us do need access to neurology services with the specialist headache clinic, and we rely heavily on the helpline guidance and support of the Migraine Association of Ireland. The latest NEI report clearly shows how neurology services are lacking for people like me. The Neurology Clinical Programme, published in 2016, recommended a care pathway for headache in all neurology centres and the appointment of 32 migraine nurses. There are many services a clinical nurse specialist could provide. For example, in my own case, several months ago, I was going through a bad chronic migraine phase and I spoke to my GP about getting a nerve block to break the cycle, try and keep me active, keep me at work. Brilliant and all as my GP clinic is, this is not a service they can provide. It is something, however, a migraine nurse can, but to get that nerve block at a headache clinic would have meant months of waiting, and that would have been long after my bad phase had passed. The Sluncha Care headache programme that recently started in 4 pilot hospitals is very, very welcome, and it's led to the appointment of 4 migraine nurses in these hospitals. But the care pathway and the recruitment of the further 28 nurses really needs to be rolled out now across the country. I'm very grateful to the Migraine Association of Ireland. They run a great helpline and they're really my first port of call if I have a change of symptoms, if I have a question about my medication. But during the last recession, the association had its funding cut by 25%, while their demand on services just continued to increase. And that's been even more so during the pandemic. As you can imagine, as access to specialist headache services has all but disappeared during COVID, many people like myself have turned to them for advice and support. So attempts really now should be made to get their funding back to pre-recession levels.